Welcome to this microlearning session on hyperkalemia or potassium greater than 5.0. My name is Ashley Portella, and this presentation is brought to you by myself in collaboration with the patient safety coordinators. Some classic signs and symptoms of patients with hyperkalemia include muscle weakness, typically seen in the legs, but it could be in the arms. You might see some urine abnormalities, so the patient may have no urine output or very little urine output. There is decreased cardiac contractility, so you might see a bradycardia or maybe even an AV block and a low blood pressure. And then there's rhythm changes, so classically there's the peak T waves, and then there's something that is called the sine wave, which is when there's a lengthened PR interval, absent P wave, and a QRS that is widened. So things you want to do is identify and treat the underlying cause of the hyperkalemia. So if the patient has AKI or CKD, they're going to need emergent dialysis and likely admission to an ICU or PCU environment. If they have burn or crush injuries, they're going to need IV fluid replacement. And you always want to review your patient's meds. Are they on potassium supplements? Are they on blood pressure medications that raise potassium levels in the blood, such as ACE inhibitors or angiotensin II receptor blockers? Or are they on a potassium-sparing med like a spironolactone? The first thing you want to do when you identify hyperkalemia in a patient is consider the potential for hemolysis or contamination. Was the blood drawn from an arm that had an IV infusing? If the answer to that question is yes, you want to do a repeat stat lab draw. The next thing you want to do is make sure that the patient has an IV access that is patent and flushes well. The next thing you want to do is notify the covering provider that the patient has hyperkalemia, and that provider might order an EKG. If there are EKG changes or if the potassium was over 7, the provider may order calcium gluconate 1 gram IV push, which is to be administered over 5 minutes. Things you want to monitor before and after administration of the calcium gluconate is you want to monitor the patient's blood pressure, the heart rate, and the IV site before and after, typically 15 minutes after administration, times 1. The next thing you might see a covering provider order is the insulin and dextrose order set. So if you see this come up, the first thing you're going to want to administer is the dextrose. So it's a D50 syringe, 25 grams. It's given IV push and it's over 1 minute, and you're not doing it wrong. It is really hard to push, so be fair warned. The next thing you're going to want to do is you're going to drop regular insulin, typically between 5 and 10 units, with a max being 20 units, and you're going to draw that up via a Luer lock insulin syringe, and you're going to administer that after the D50. And you're going to follow that with a 20 ml normal saline flush, so 2 flushes after you administer the insulin. Some other orders you might see a provider order include albuterol. No, you're not going crazy. No, your patient is probably not short of breath, and you might be wondering, why am I giving this? Well, albuterol helps to create an electrolyte shift, so it moves the potassium intracellular, which lowers the serum potassium. Other common drugs include Lokelma, which is given PO, and it's a binder and it helps excrete potassium. You might also see Kxalate, which is similar. That can either go oral or per rectum, and that's also a binder and helps excrete potassium through the stool. And then you might see Lasix. And what Lasix does is it causes a patient to urinate more than normal, leading to lower levels of potassium in the body. Really important monitoring you want to do after giving someone the IV insulin and IV dextrose combination is you want to monitor their blood glucose every hour times 3. And you also want to monitor their mental status. If there are any acute or concerning changes in mental status, you want to either activate a REV or notify the provider immediately. Other things that you might have to do is recheck a potassium level in either 30 or 60 minutes to make sure that treatment is working or the potassium is at least coming down.